Hello friends, I Yogita Singh welcome you to our show on World Brain Day. Living in this modern era, most of us are highly concerned about our well-being and beauty. Gym, pool and parlors have become our second home. We all want to look very attractive. But beyond our external body, we hardly have any direct hold on our nervous system or brain. We certainly look presentable with carved and shaped physique, but we hardly remember that our brain and nervous system have complete control over our body. We do easily handle short-term ailments. We can name them like fever, allergies, indigestion, aches, sprains, etc. But what about our neurological disorder? Can we afford to take that easily? No, not at all, because it's horrifying and increases 100 times more when our doctor declares the name of the disease, and that is epilepsy. It is hard to bear the shock and accept the fact that we will have to now fight and deal with epilepsy. We hesitate to disclose the fact among our relatives also, because we know if disclosed, millions of unwanted, incorrect and confusing opinions are thrown at the patient. Family, especially the patient who has been suffering from epilepsy, gets very depressed and is very confused. In this state of mind, they choose a wrong path of treatment which ultimately becomes very fatal. So my dear friends, in order to guide you and educate you to win over this disease, today we have with us a very well-known and highly experienced neurologist, Dr.L.K.Malhotra. Welcome, Dr. Saab. Doctor, I have got too many questions which are related to epilepsy, and there are so many apprehensions and we need to clarify all the doubts. Begin with, what is epilepsy?
See, epilepsy is basically a neurological disorder which is primarily caused by electrical disturbance in the brain. And whenever there is an electrical disturbance in the brain, it causes a seizure. And seizure is basically a symptom of epilepsy. Whenever a patient has 2 or more seizures, then we say this patient is suffering from epilepsy.
Dr. Malhotra, I would like to know, what are the symptoms by which you can diagnose epilepsy?
See, the most important symptom with which we diagnose epilepsy is, it is the description of the fit or epileptic attack which the patient has, which has been witnessed by a person. Because during this phenomena, by and large, patient is not conscious and he is not aware what has happened to him. If at all patient comes to a doctor, he will come with he felt dizziness, he became unconscious, and immediately when he regained consciousness, he had some headache, vomiting or fever. So by this we are able to reach some conclusion by the description of the witness that it was a seizure.
Okay. Dr. Malhotra, what are the different types of epilepsy?
The epilepsy is not a homogeneous disease. It has many causes, many symptoms. The first one is, it is a very common phenomena which occurs, which even a layman can diagnose. It is a generalized tonic-clonic seizure. In this, the person has some tonicity of the body. He develops then jerky movements. Along with this, he remains unconscious for some time and then gradually regains in consciousness. And when he regains consciousness, he has some headache, vomiting, body ache, fever, which lasts for a few hours or few days. This is one type of epilepsy. The other types which I am going to describe is, they are subtle seizures. When we diagnose these seizures, it is a very high index of suspicion on the part of witness who is observing these patients. The second type is a partial seizure. In this, the patient remains conscious throughout the episode. The symptoms, they depend upon from which part of the brain the epilepsy arises. If it arises from a visual area, then patient has a visual symptom. From a motor area, then a motor symptom. From a sensory area, then a sensory symptom. But this can also become secondarily generalized and patient can lose consciousness.
Okay.
The third type which I want to emphasize is, it is an absence seizure. This is a type of seizure which is by and large seen in children. And in this, the commonest symptom is, patient stops doing whatever he is doing. He stares in the blank space. It appears he is daydreaming. This phenomena lasts for 2 to 10 seconds and it stops abruptly, and the child continues to do whatever he was doing before the onset of the episode. But he doesn't fall, doesn't injure himself. If these episodes they are frequent or prolonged, then they can be interpreted as absent-mindedness or inattentiveness on the part of a teacher or parents. That is how they come to us. The other type of seizure is a complex partial seizure. It lasts for few minutes. It may last for 2 to 3 minutes, and after the episode the patient tries to remain asleep for few hours or few minutes, and during this phenomena the patient has some oral movements, lip smacking movements, he protrudes his tongue, he has some movements with the hands also. The last type of seizure which I want to mention is a myoclonic jerk. In this, the patients they have a sudden jerky movement of the limbs or of the body, but they are fully conscious during this phenomena. If they are predominantly in the hands, then the patient may drop objects from the hands. If it is predominantly in the legs, then the patient fall on the ground. Commonly, we also have myoclonic jerks whenever we are going to sleep or whenever we wake up in the morning. These are normal jerks related to the sleep. But whenever these myoclonic jerks they occur in a wakeful state and they are symptomatic, they cause symptoms, then we say they are abnormal myoclonic jerks and they are to be treated.
That's very true. When you spoke about myoclonic jerks, I was a bit shocked because I could relate it with somewhere with me also. Do some other diseases also mimic epilepsy?
There are many conditions which can mimic epilepsy. By and large, it is the neurologist who decides whether the patient is suffering from epilepsy or not.
Okay.
After hearing to the complaints and after investigation. But there are two specific situations which I want to highlight. One is in school, by and large, the children they become unconscious while standing in a prayer. In this phenomena, you see, whenever a patient stands for a longer duration, he becomes pale, falls on the ground, and whenever he falls on the ground, and immediately he regains consciousness. If we feel the pulse is very feeble. This phenomena is called syncope. Sometimes during this phenomena, the patient may have some jerky movements of the body also. The second is, which is sometimes stress related. In this, the movements which the patient is having, they are very bizarre, they are not stereotyped, and sometimes the patient may remain unconscious for a very long duration, and patient may not have any symptom whenever patient becomes conscious. This we call as pseudo seizures. It is not an epilepsy, but it can be misinterpreted as epilepsy if not diagnosed properly.
Dr. Malhotra, what all investigations are suggested for the patients of epilepsy?
See, we do certain blood tests like sugar, calcium, kidney, liver function tests, X-ray chest, and specific investigations like EEG, CT scan and MRI.
Okay. Now, what is EEG?
EEG is basically you can consider as an equivalent of ECG of the heart. It tells us about the electrical activity of the brain. As I mentioned earlier, the seizures are basically caused by abnormal electrical disturbance of the brain, and we detect this abnormal EEG activity in the EEG. In this test, we basically apply certain electrodes to the scalp and you record the electrical activity of the brain. Sometimes we do this EEG after telling the patient that he should not sleep throughout the night. That is known as sleep deprived EEG.
Okay.
Because this sleep deprived EEG increases the chances of EEG being abnormal. In certain percentage of patients, in spite of patient having seizures or epilepsy, EEG may be normal. So after doing this sleep deprived EEG, the chances of EEG being abnormal, it increases.
Okay.
And the third is, it is a video EEG. In this, you record the patient's video, simultaneously you record the EEG. In case the patient has a seizure during the recording, that can be videographed, as well as the simultaneous EEG abnormality can also be detected.
Okay.
This is what we do in EEG recording.
Fine, but now that's very much clear to me now. But Dr. Malhotra, there's one more question that keeps on arising. What are the causes? Why does epilepsy happen?
You see, as I told you earlier, epilepsy is a heterogeneous disease. It has got n number of causes. In children, the commonest cause is birth-related issues, lack of oxygen to the brain. That is the commonest cause. The other causes are, it could be brain tumor, it could be brain infection, brain neurocysticercosis. It is a larva of the tapeworm which infests the brain and it can cause a seizure. Certain infarcts or the clots in the brain. Sometimes the fever can also trigger a seizure. Head injury can also be a cause of seizure. In acute head injury, you may have a seizure. Epilepsy can be a sequelae of head injury. So these are the common causes of the seizure.
Oh my God. Ajay, what should be the action taken once you see somebody that there's an attack of epilepsy?
This is a very important question for the public to be addressed. The most important thing is one should not panic. That is very important. One should not lose his cool. Then see to it that people do not surround the person. The other thing is, when the patient becomes gradually conscious, patient may vomit. Because of that, you turn him to one side so that patient does not any choking. In case these movements do not subside for a longer duration, then it is better to shift the patient to a hospital. But in majority, these movements, they subside spontaneously within 1 or 2 minutes.
Okay. Dr. Sir, there is one more question that keeps on bothering me a lot. Is there any side effect of the medicines of the seizure? I mean, or the epilepsy?
No medicine is free from side effects. But one should know that not all the side effects are seen in all patients. So whenever a patient is taking a medicine, if he notices certain change in any aspect, it is better he consult a neurologist. Then let neurologist decide whether it is a side effect of the drug or not.
What precautions you suggest to the patients who are taking the medicines of epilepsy?
The most important precaution is taking the medicines regularly and religiously. Because once a patient misses a dose, the level of the drug in the blood falls and patient may throw a convulsion. So patient should take medicines regularly. And the other precautions are, he should have a proper sleep. Lack of sleep also triggers a seizure. He should not skip his meals. After skipping meals, sugar becomes low. A seizure may be triggered. He should avoid all the intoxications because these also trigger seizures. And above all, he should not stop these medicines abruptly, because if he stops these medicines abruptly, patient can have cluster of repeated attacks and he may end up in hospital. And he may even die during this phase.
That's really very true, because I have come across several patients who just say that now we are all right and we are not taking the medicines anymore now, and they actually come up and they end up with the disease which is not curable after that.
That's right.
I've really come up with this. Well, now I would like to ask you a very serious question. People love watching television. Even if you're not well, you love watching television. Now in that case, the lights of the television, the DJ lights or the television, is it going to harm in any case?
You see, this is a very important and practical question. There is an entity called photosensitive epilepsy, meaning thereby that the seizures, they are triggered by the abnormal lights, like flickering TV lights, DJ lights, even computers, disco lights, the video games. These can trigger seizures. If these are the only causes which trigger seizures, then we say it is pure photosensitive epilepsy. But there are certain patients with seizures who develop epilepsy spontaneously. They can also have seizures with this phenomena. This type of epilepsy is seen only in 10% of patients.
Dr. Malhotra, I am a patient of epilepsy. I religiously take medicines. I don't forget taking it. What is the guarantee there will be no recurrence of epilepsy?
See, there is no guarantee as such that there will be no recurrence of epilepsy. Whenever we start a medicine to a patient who comes to us in the beginning, we gradually build up the dose and continue with a single drug. Sometimes patient may require 2 or 3 drugs to control seizures. So in this situation, when a patient is on only one drug, he may throw a seizure.
Okay.
So whenever he throws a second seizure while on a drug, he should consult a neurologist.
Does the full course of epilepsy give a guarantee that I am going to be alright? I'll not have any other attack?
You see, by and large, whenever we start the medicine in these patients, we continue the medicines for about 2 to 3 years.
Okay.
This is a long treatment. And during this phase, the patient should not have any seizure. This is very important. By and large, what the patient thinks, you continue the medicine for 3 years, irrespective whether patient is having seizure or not. After stopping the medicines, around 20 to 30% of patients may develop a relapse.
Oh.
But in majority of patients who develop a relapse, they develop relapse when we are tapering the medicine or within the 3 to 6 months after stopping the medicines.
Okay.
So by and large, it is around 70 to 80% who do not develop relapse.
That's really good. Now, what is the role of surgery in the patient of epilepsy?
There are certain abnormalities which are seen in MRI, like brain tumors. If you remove them, the patient may become seizure free. However, there are certain specific types of epilepsy, like complex partial seizures or temporal lobe epilepsy, in which you do all the detailed investigations, MRIs, invasive EEGs also, brain SPECT, then try to localize a particular area of the brain from where the epilepsy starts. And if you try to remove that area, the seizures might get controlled significantly.
Dr. Malhotra, a woman has epilepsy. Can she lead a happy married life?
Yes, why not? The woman has a full right to marry and full right to have children, no problem.
That means she can get pregnant also? There's no problem at all?
Yes, why not?
Okay.
She can get pregnant, but the only thing is she has to share everything with her gynecologist as well as neurologist. That is one. Whatever medicine she is on. Second is the dosage of medicines have to be adjusted during pregnancy.
There's one basic question, Dr. Saab, which actually bothers a lot, especially to the mother-in-laws and father-in-laws in the family. They say if a woman is epileptic, her child may also develop the same problem once the child is given birth. Is that true or is it a myth?
You see, this is a very important question. I think for this, I would like to refer to a video of my colleague, Dr. Rajiv Anand.
Lovely. Let's see that.
Definitely, like diabetes, there is no direct inheritance, but the incidence of epilepsy in children of parents of epilepsy is more than the normal population. And if both parents are afflicted, the incidence may be more. And there are certain types of genetic epilepsies we do find, but they are rare. Commonly, epilepsy is not inherited as a direct genetic inheritance.
There's one lovely thing that has happened, and that is, even if you are epileptic, you can have a very lovely married life. You can have a successful married life. You can even conceive. But there are few things which should be taken care of. Dr. Malhotra, now a very serious question. If a woman is pregnant and she is consuming anti-epileptic drug, now will it have any side effect on the baby or the female itself?
You see, all pregnant patients who are taking anticonvulsant medications, they have to continue these medicines regularly and religiously. Because in case the patient has one generalized tonic-clonic seizure, then the seizure may cause more damage to a baby than anticonvulsant medications.
Okay.
So the patient has to continue with the anticonvulsant medications. But I will tell you certain statistics which will clarify your doubts. One is, you have a normal person who is pregnant, not on any medication. Even this patient has 2 to 3% chance of having an abnormal baby.
Very true.
But a person who is epileptic and who is taking anticonvulsant medications, this percentage rises to 4 to 6%. It simply doubles.
Very true.
The third statistics is, more than 90% of these patients, they have normal delivery and a normal baby.
Okay.
So this should be highlighted.
This
This
is
is
more
very
important. Yeah, because most of the time we feel that if a person is suffering from epilepsy, that person will not deliver a good baby or the baby won't be healthy. Now the next question that's coming up, it's very serious question actually, Dr. Saab, is breastfeeding. I mean, do you suggest such mothers to breastfeed their child? Those who are taking these medicines?
Yes, yes. You see, the amount of drug which is excreted in the breast milk is negligible.
Okay.
It is not going to cause any side effects. In case mother notices that the baby is dull, lethargic, drowsy, then she should consult a pediatrician, or she can alternate between breastfeed and bottle feed.
That's lovely. Dr. Malhotra, do you think epilepsy is fatal in any case?
You see, what has been mentioned in literature is the epilepsy patients, they have slightly more chances of premature death. But there is a caution behind this. The patients who are uncontrolled, who are on multiple drugs, who consume alcohol, so actually these are the patients who are more prone for all these phenomena.
True.
The second thing is, these patients may develop a seizure, and during this phenomena they may have head injury. While swimming they may drown. So they are basically accident related deaths because of the seizure.
Very right.
And the third thing is, epilepsy is a second most common cause of unexpected death after stroke in patients of epilepsy.
Mr. Jones told the ABC he wanted to be a pilot, but his epilepsy ruled that out, and he believed that his condition had improved enough to enable him to skydive.
Dr. Saab, I can just tell you a small story. I came across a person who was driving and he had the attack of epilepsy, and he accidentally, just smashed the car on a tree and he died on the spot. This was the most serious thing that happened into my life, and I could not, control my tears for this. Had he had somebody with him, beside him, this accident would have been prevented the other day. Anyways, Dr. Saab, what are these superstitions which are actually associated with epilepsy?
This is a very important question for public.
Yeah.
The commonest superstition is, it is a curse of the god. Some patients in villages, they go to faith healers, babas and tantrics for treatment. Some feel it is curse of the god, some feel it is bestowed by the god. Second is, this is not an infectious disease. The relatives of the patient, they come and ask us whether we can eat the meals together. It is not an infectious disease. Third thing is, sometimes the family feels it can be cured by marriage. This is also not true.
Very sad.
These are the three most important superstitions which are associated with epilepsy.
Well, epilepsy is a disease which can be cured. As I have heard you have been speaking very religiously about taking the medicines. If you stick to the diet, the routine that you have ordered, then epilepsy will not reoccur. This is something very important and we should follow this, and we have just tried to give a small message to the audience who are associated with us, so that epilepsy doesn't actually hamper their routine life and they lead their life successfully. They can even marry. As you said, everything is going to be fine with them. Well, Dr. Saab, thank you so much for all your lovely inputs that you have given for epilepsy. Thank you very much.